into the cloud. I just admitted everyone and I disabled the waiting room. Oops. Okay. All right. So how's everyone doing? I hope you all had a wonderful day. Welcome to our final webinar, which is the 2023 Zero Barriers in STEM Education Summit Day-to-Day and Final Summit Prep webinar. So today we have a session that's split into two parts. The first part will be focused on data, and the last 30 minutes or so will be focused on making sure that you are prepared for the summit in a few weeks. As you all know, my name is Sherelle Williams. My pronouns are she, her, and hers. I am the program manager for DEAI programs at the Smithsonian Science Education Center. I am a Black woman with black braids, and I'm wearing a blue shirt. And I will be co-facilitating the first part of tonight's webinar with Dr. Danielle Boyce. So I will allow her to introduce herself before we continue on. And we can go to the next slide just so we have some visuals as well.
There I go. Hi, I'm Danielle Boyce, Dr. Danielle, but please call me Danielle. I am a data scientist. I'm also a patient advocate, and I'm an data equity advocate. And I work at Johns Hopkins and other places. I have contract work with Emory and the Critical Path Institute. My focus in my work is big data, so electronic health record data, drug repurposing and things like that with the FDA and other places. But because I have a child with rare epilepsy, I also have learned a lot about the importance of small data and really understanding the importance of every kind of data and all the people who sometimes get left out when we're collecting data. And so that's how I was connected with this program a few years ago, in sharing my expertise and kind of bridging my knowledge from clinical research into education. I'm very excited to be with you today. It's very informal, so please go ahead and put things in the chat whenever you have any questions.
That's right. We will actively be monitoring the chat throughout tonight's session. So as Danielle said, please do leave your questions, comments in the chat. And we can go to the next slide. Just as a quick reminder that we are recording. We also have ASL interpretation. If you want to, keep your eye on that. That is going to be available throughout the entire session. But just be mindful of what you share. We will be asking everyone to turn off their video until we kind of open up the conversation for more commentary, excuse me, and for you to kind of share your perspective and thoughts. But while we're facilitating, just to reduce bandwidth during the session, just keep your videos off, and of course stay muted unless you are invited to share your thoughts throughout tonight's session. Next slide. So as I mentioned tonight, we're kind of splitting the session up into two parts. The first part is really going to be focused on data equity, what it is and how it's collected, and then we'll also be discussing ways to improve current data collection and review some methods to make it more equitable and accessible. And in the latter half of tonight's discussion, you'll have the opportunity to meet with your team and discuss some other things that you might need to kind of finalize as you prepare for the summit. Next slide. So we will start with just a quick little exercise. We have 3 images here, and I'd love for you to respond in the chat by identifying which one represents equity, which image represents equality, and which image depicts accessibility. We got A, B, and C. So I'll give you a moment to think on that, and again, just respond in the chat with your thoughts. Okay, I see A, equality, B, equity, A, equality, equity. Okay. All right, thank you. All right, we can go to the next slide. I appreciate you all responding engage in that exercise. And so if you said A was equality, you were correct. If you said B was equity, you are correct. And C, accessibility, you are correct. And so the point that I'm trying to kind of get at here is that equality really is about making sure that we understand that everyone has the same opportunity versus equity, which is making sure that everyone is provided with the same opportunity using the tools that make the most sense for them. And then you got accessibility, which is really about reducing the barriers that exist so that everyone can fully participate, right? And you can see very clearly how folks who are, that have the fence that allows them to see through it, there's just a lot less burden on each individual to be able to participate and watch this game that's happening, right? So how might this relate to data? So we think about each one of these: equity, equality, accessibility. How do these terms relate to data and what we think of when we think about data? Data collection, how we use it, all of those things. And you can feel free to come off mute or feel free to share a thought in the chat. How does it relate to data? You might consider how you currently collect data for the educator or the student. Either, really, just data can indicate whether or not needs of students have been met. Accessibility means everyone has access. Kind of lost track. Accessibility means everyone has access to the data at the same level. I'm seeing if you are collecting data on one aspect, example accessibility, you might miss important information about the other aspects. Data sometimes does not measure the circumstances of the individual student. Right, so all of these things, like there are so many opportunities to get a lot of information, but depending on how you're collecting it, depending on, the method of collection, depending on the audience that you're collecting it from, there's so much information that you could be missing out on. And so that's really what data equity and also accessibility is all about. We're making sure that we're getting the full picture, telling the full story. So with that, I will hand it over to Danielle to continue this discussion around data equity.
Hi, and I realized I forgot before to describe myself. This is Danielle Boyce, and I am a middle-aged white woman with short hair, in case that's helpful to those who would like that. I think we need the next slide, please. How to collect and use data to understand your specific equity issue. I recognize this is a very, excuse me, broad topic. So next slide, please. There we go. Hold on, I'm just adjusting my screen so I don't have a million pictures on it. There we go. So data equity is a growing movement for more responsible data work, from analytics and data visualization to data science and machine learning to data-driven decision-making. Equity seeks to ensure fair treatment, equality of opportunity, and fairness in access to information and resources. And it's a set of principles and practices to guide anyone who works with data, especially data related to people, through every step of a data project through lens of justice, equity, and inclusivity. Equity is both an outcome and a process. This was a great definition that I found on data.org. And I provide this resource later in the slides. I really recommend that website. But I love this idea that equity is both an outcome and a process. And I'll give you an example that just happened about 5 minutes ago in terms of that process. Just when you think you know everything, you realize you don't. So I was just reading this slide, this definition really quickly. And our interpreter here said I was reading it too quickly, right? We're going to need to slow it down so that he could do his job and do the ASL interpretation. And so here I am presenting on equity, right? And I needed that reminder. So this is a process. And frankly, that's what data is too, always evolving and changing as we learn more. And it's the same, the more we pull people with lived experience into our work, the more we learn, and the better this body of work becomes. So we're never done. And the other thing is, I'm going to look in the chat right now. Yeah, this is the link that she provided. I always check the chat because I work with people who have ALS, and I'll talk about this in a minute. And a lot of folks with ALS or Lou Gehrig's disease use eye gaze technology to communicate. And so I always like to check the chat and make sure that I'm not missing something that that is urgently being said. Okay, next slide, please. So first, we're going to just build on your existing knowledge. And yes, I'm a data scientist and I teach data science at Johns Hopkins. And I feel like that can be really intimidating. But honestly, most of what I know, I know because I'm a person in the world and I care about things. And I have a narrative that I understand about the world around me that I want represented in data. And so one of the things I really like to do when I talk to people, many of whom say I'm not a data person, is to kind of help you to connect to that inner data analyst, that you are. And so one question I have you ever felt like data misrepresented you? You can just throw that out in the chat or go off mute. Have you ever felt like there was a report that was meant to represent you, or some other characterization? Yes. BMI. Hey, that's a good one. Listen, that's close to home. But yes. Yeah. So, I mean, I can give you an example I was thinking about. Well, and BMI, that's a great example, actually. BMI is a great example because BMI was not designed for the way that it's often used today. Right. And so it misrepresents. So if people say, people with a certain BMI are not active and need activity intervention or need to lose weight, and meanwhile, it's somebody like Serena Williams, who's the most athletic person in the world, right? I think about that. BMI was not meant to do what a lot of people use it for. So that's excellent. Also, the population is only white. Yes, and that's true in a lot of the measurements we use in clinical research as well. I can give you an example when I hear suburban white females over the age of 45 vote XYZ way. Okay, speak for yourself. That doesn't represent me usually. And what's interesting is that's a framing issue too, because they probably may have collected accurate data, but the way the data are presented to push in a specific agenda. So it might not be that you weren't asked, it's just that you were asked, and then because you were in the minority, they didn't include your story. Yeah, these are great examples. What do we know about data equity and accessibility? We talked about this a little bit and how we define it. But talk to me a little bit more, like the definitions we choose. In clinical research, we talk all about operationalizing our variables. And I think that's so important. I'll just give you an example just to kind of kick it off here, but we'll operationalize our inclusion criteria for a study. And so often we do not make sure that inclusion criteria includes people who, let's say, don't speak English, right? We might exclude them because we don't know how to translate the consent form to the languages that we need, right? So defining equity and accessibility and what that means in your specific circumstances is really important. And why is it important? Oops, I didn't mean to do that. I think, let's see, I'm going to read the chat here. I think data is affected by both internal and external factors. I'd like to hear more about that. I agree with that. I can think of an example internally. we might do a survey. I think we're going to cover this in a minute, but we might want to do a survey of parents. So this is true of me. I'm a working mom. My husband does most of the pickups, or my kids take the bus. And if they wanted my opinion on something, and the way to get my opinion was to fill out a survey when I came in person at 3 o'clock in the afternoon, they're not going to get my opinion. They're only going to get the parents who don't work, or who work at a different shift. And so that the results are going to exclude me and misrepresent me. And I think a lot about that in my clinical research. Right. And so maybe we can move to the next slide, please. So what information are you missing? So just think about your own work. What information are you missing if your data is not collected equitably or with accessibility in mind? Who is disadvantaged when you don't consider equity and accessibility in data collection? And so I'll give an example that I like to use a lot. A lot of the work that I do, as I mentioned, is with people with amyotrophic lateral sclerosis, or ALS. This is a terrible disease, Lou Gehrig's disease, that often results in full body paralysis, including your mouth, so you can't speak anymore. But it strikes people at really the prime of their life. And these are some of the most brilliant, talented, successful people who just want to contribute, but they're on full disability. And so one of the things that I do is I help to connect people with ALS to researchers who are designing studies for people with ALS, to help them to understand how their study may or may not be successful based on how they're setting it up. And so I won a grant to do this work with a group that is creating one of these edX type of, online Coursera type courses. And it was discovered that people with eye gaze technology, who are most of the people I work with, use that if they're at an advanced stage. We have this wonderful eye gaze technology that allows them to communicate with their eyes. But the tools these online tools that were developed that the patients were meant to interact with were inaccessible to people with eye gaze. They couldn't fill out the survey. They had trouble moving the pages around and such. And so here is an ALS study that only certain people with ALS, people who were affected only in a respiratory way, and not people who couldn't speak, were affected by this. So you would have really had a skewed sample if they hadn't made those modifications. I'm looking at this. Oh, I know Sarah. Oh my goodness, I know Sarah Langs and all. This is amazing. Yes, and there's a group that I work with. I'm looking at Ms. Ding's comment. There's a group that I work with called Her ALS Story, and it's all young women with ALS. But that's exactly right. Perfect example. Another equity example in ALS. It is perceived as an older white male disease, and that is not true. So let me scroll up. I think data is affected by both internal and external factors. And Kayla said that was very true, what I was saying about the school pickup. The busiest people that don't have access to internet. That's right. A lot of times surveys are not responsive on the phone. I learned this one. And some people only use their phone. Some people do everything with their phone. It's amazing, but they don't have a home computer or internet access at home. And so if you have a survey that's really hard to fill out, and you've done that before, I'm sure, gone to a website and it's kind of wonky on the phone, you can't, you're excluded. And I have found that a lot of the folks that I work with who are tend to be marginalized in clinical research have issues like that with the phone. People may not be represented well if we have lack of equitable data. That's right. That's exactly right. You're a product of your environment, so you may not necessarily have all the tools necessary to produce a fair outcome to certain data points. So I would throw out there that is absolutely true, and why I always try to include people from, representing the group that I'm trying to make sure that I capture. People with lived experience, people with ALS, people with epilepsy. It's amazing, like with the eye gaze issue, it's amazing how quickly they pick up on the things that you're missing, and how much they improve your work. Because certainly, part of this equity work is to be humble enough to know what you don't know, right? And to recognize your potentially own bias, even subconscious bias. Oh, I'm so glad that you've read the ALS story. I love it too. Data is often collected this is from Rebecca, to then make decisions and create programs. When there are gaps, bias in the data collection, the decisions programs will never meet the needs of the group. Can I have this statement bronzed? That's exactly right. If equity is a process and a product, they need each other. That's right. A lack of equity in data collection will never result in an equitable product. That's excellent. Yes. You'll miss populations if they aren't provided accessible options to provide data, which in turn means you will not have a complete data set or a complete picture to make meaningful conclusions. That's right. And we talk a lot about curing folks with big data. I do drug repurposing work all the time. And then the data that I get, all these big, beautiful data sets, are from certain areas of the country, or certain hospitals, and missing, whole big parts of the country, missing all of Texas, for example, missing Arizona. And I'm thinking to myself, how are we really going to understand diversity, if I only get this skewed picture of the patient population that we're seeing? And so that's what a lot of these movements, you'll read this in this data.org, they're around that. I mean, this is life or death. This is not just something nice to do. We need equity in our research to cure people. And in the educational setting, I don't have to tell you, and just like with the example, the very benign example of, they didn't ask me my opinion at the daycare because I was too busy working, or they sent me a Zoom link, or, a survey link, and I just, my email, I'm just buried. Would have been much better if they sent me a text, is kind of how I work. They would have missed my opinion and then they would have had the program at 3 p.m., because that's when all the other moms could make it, so that's what happens in a very benign way. But, the consequences are greater for other groups of people. Overall, when data collection, this is Ezekiel. Overall, when data collection is not conducted equitably or with accessibility in mind, it can result in a distorted understanding of social issues. Yes. Perpetuate inequalities and hinder the development of inclusive and fair policies or interventions. Therefore, it is crucial to prioritize equitable data collection practices to ensure a more accurate representation of the population and enable evidence-based decision-making that considers the needs and experiences of all individuals. I love it. This is a group that has thought about this. Group from underrepresented group may disadvantage the most if we don't consider equity and accessibility in data collection, because the dominant narrative and biases that we may have as the researcher. Yeah, I understand what you meant. I meant people from underrepresented groups. Yes. Yeah, that's exactly right. It's almost like you forget that they're even there. And I say this a lot to my students. There was a time where we did data collection where we didn't have SurveyMonkey, and we actually went to people's homes and tried to figure out how we could find them, right? And so that is an option, and something that I'm probably going to touch on later, is different methods, modalities of data. I had a chip on my shoulder before I had a child with rare disease, where I thought everything could be solved with statistics and a p-value. And I thought people who did qualitative work were just doing that because they didn't know enough about statistics to do it right. Like, that's what I thought, But then I realized that in rare disease, we don't know what we don't know. So we can't predict it enough to write a question, a closed-ended question. We have to let the narrative speak. We have to understand lived experience in order to even know what questions to ask. And so that's a way that we often exclude people too. We say, do you have this, this, or this? And we don't even know that they could have 5 other things. And we didn't ask. So it just looks like they, have one of those 3 or not, or nothing. Research is also done on a specific gender population. Yes. On male mice. That is so true. That's exactly right. What about female mice? How does that translate? I actually read an interesting thread on Twitter the other day about how people don't publish what their male mice or their female mice, what the results are like. They don't publish the other gender, and they should, because that's useful information. People with disabilities are considered in data collection when accessibility and equity is not considered. Yeah, so I mentioned I have a child with rare disease. My Charlie is 13, but kind of like a baby. And a lot of you're all educators, special ed. So he had a condition called infantile spasm, so really terrible seizure disorder. And I'm sure kids like Charlie. And oftentimes these questionnaires I get, whether it be the autism questionnaires or intellectual disability questionnaires, they'll ask me questions about how he feels, or they'll ask questions that he's supposed to answer. And I can't answer. I don't know. And he can't speak, right? So what do they always say? Just do your best. So we all do our best in a different way, and we're all answering it with our own, biases and questions. And so the products and programs that are a result of these questionnaires definitely don't represent us, because we didn't have a way to really give our input. Minorities in the classroom during high-stake decision-making meetings. The minorities are often overlooked. When people feel they have no voice, they are unlikely to want to speak up. Oh, I love that statement. Or even attend the high-stake decision-making meetings. I learned this lesson once. I did a program for kids with disabilities in Baltimore. We had through the early intervention program, and we invited parents of kids to the museum, to go to the museum and do their occupational therapy there. It was really neat. And that's kind of one of the ways that I would do therapy with my son. And there were people who in that program who had never been to that museum, and they lived right around the block. And it's because they felt they would not be welcome. And it was a free museum. Let me tell you, that changed my view of the whole world. You did not feel welcome in this beautiful museum, right? And so that always I always think about that when I design these types of interventions. By not considering equity and accessibility in data collection, these groups may be further marginalized, their voices and experiences may be silenced, and the development of inclusive policies and interventions may be hindered. To address these disparities, it is important to prioritize equitable and accessible data collection practices and ensure the meaningful inclusion of individuals. Okay. And I'm gonna wrap this up. Data must be collected over time. And yeah, doing Gallup poll surveys. You don't understand how Gallup compiled the results and how skewed the data was. Yes. So, all right. So we're gonna wrap it up. These are really great quotes though. And I was just thinking I would love to capture these somehow and somehow follow up with all of these. So just kind of put a pin in that. I know we're probably saving the chat, but I feel like this would make some kind of great something. So anyway, so shall we move on to the next slide, please? Or to the case study. There you go.
Right.
Perfect.
So yeah, I mean, we could now is the opportunity for you all to kind of continue this conversation and think about how the case study that we asked you all to read kind of connects back to this discussion on how equity really can make a difference for, in the particular case of the case study, students who were not necessarily getting their needs met. They were not being supported in the way that was helpful for them in the STEM program at Virginia Tech. We can go to the next slide. So you all have the opportunity, hopefully, to review some of the materials for the case study. And so we are going to give you about 15 minutes in breakout groups with your team to, and we can go to the next slide, to discuss three different things. First, how was the data used in a way that is equitable and accessible for all of the faculty members who had a chance to then analyze it, right? So where do we see evidence of that equity and accessibility in the data collection, but then also in the analysis of the data that was provided to faculty members to make decisions, right? And then ultimately, how did they use the data to make decisions that were more inclusive and equitable for the students they were trying to serve, right? So one, think about the process. Two, think about the analysis. Three, think about the decisions that were made based on the methods that were used. Are there any questions about any of that before we move you into breakouts? And I can drop this question into the chat as well to make sure that you can reference it. But I just want to make sure that you do have a chance to talk about it in your team breakout, and then we will come back together and share some of the things that came up in your group.
Yeah, I'm really excited to hear this because this group is really obviously very well versed in this topic. So it's going to be great.
Well, if we're all set to move, I think Alex has gone ahead and opened up the groups. Join the group based on your team name, or the breakout with your team name, and we will see you back in a little bit. Things that came up in your team conversations. I'd love to hear more about what you drew from the case study that we had you read. Oh, I'm so sorry, Frank. But you all were in there for a while, so I'd love to hear what came up for you. Okay, usually, oh, hold on. Okay. Anyone want to kick us off? I see a hand raised from, who is that? Oh, Kayla, you can go ahead.
Okay. We had some really good conversation about it. One quote that that one of my team members mentioned was on that first page where it says, "Stop trying to fix the student and fix the institution." And we kind of brought that back to the picture that you showed in the beginning with the equality, equity, and accessibility. And just talking about, instead of giving the one student the 50 crates that they need to succeed, remove that whole barrier so that we don't have to pull out those 50 million resources and let that student be successful, like along with everyone else, you know?
That's exactly.
So that's mainly what we talked about. And then we also talked about just the importance of qualitative data. Like, numbers are just going to be numbers, but when you have that additional qualitative piece to understand the why behind, like, it will start to make a lot more sense. So
I love that. I love that. One, what I'm hearing is like UDL. I mean, and that's essentially what we're trying to go back to when we talk about accessibility and inclusion, using universal design or universal design for learning as a way to make sure that everyone has what they need without adding 10 different layers, or, differentiation is important in some aspects of the learning environment, but there are times when you can do one thing and it really meets the needs of a variety of students in your classroom. And so doing more of that, considering how we can do more of that so that everyone gets what they need, and we're not retrofitting every single lesson or every single activity to ensure that everyone has the ability to participate. So I love that you all capture that in this, because that's essentially what happens here. When we use data to really understand what our students need, we can make those types of decisions. Anyone else? And then I'll start looking at the chat. Ezekiel, I see your hand.
Yeah, for our team, for Hartsville Elementary, we discussed about all the things that we have already in place, but sometimes it's hard to get it when you don't know what you don't know, you know. And I mentioned to them that it's super important that understand why we need to start with the strengths of each of us. I mentioned, for example, when you were talking about here, the story of me, education open doors, and I didn't realize that I was part of ADHD myself, and I finally understood myself when I was older. And if we have high expectations, like a teacher did for me, it will make a huge impact on the students too. And that's where, as I mentioned, also we need to have a protocol to follow in this design process. And I just sharing an example here in the chat that this is the one I also shared with you too in previous conversations. And we need to involve with, in this case, for the research that you share with us, one part is the quantitative data, but also it's super important the qualitative data too, that we need to also collaborate and iterate with everybody involved in this process, because sometimes we left behind the most important part of the students. We don't hear
That's
their
right.
voices when those are the ones who we need to start first, you know, and that's a challenge, and we have a always have a cycle of improvement and go all the time. The first time probably we don't get it, but the second time we will improve and keep moving forward. So uh, thank you.
Yeah,
Thank
I'd like to
you.
comment on that around qualitative data. You're absolutely right. And, you know, a lot of times we don't, we're pushed away from qualitative data because people don't know how to analyze it, right? And you know, you can't put it in a little box and you can't put it in a chart. Well, you can though, because you can make themes and then draw codes from it, you know, if you know what you're doing. And also with the advent of all these tools, I work with natural language processing, AI, you can thematically analyze just reams of data that are qualitative narrative. So there's really no excuse for that. And we find that very, very important in understanding the like, for example, the patient experience, or, you know, especially when rare outcomes, and you don't know maybe what caused what, you know, and just to get their whole background in one note. That's how we communicate, is in a qualitative way. And so that really breaks down barriers to me. If you're willing to do the analysis on the back end, qualitative data is really something that you should focus on. So I'm really glad that you mentioned that.
Yeah, and I just want to read a few comments that were dropped in the chat. So Frank, you mentioned talking about the importance of having someone like Danielle sort the data. That actually was something that I thought was important, right? Because that makes the data more accessible to all the faculty members. It reduces the burden on them to try to figure out, you know, how they're going to analyze it. It's very clear what the information is telling us, and now we have the opportunity to just make decisions and kind of get to work, right?
Yeah.
Oh, go ahead, Danielle. I don't know if
Well,
you...
I was just going to say, and also don't ever be afraid if you have a data project and you don't know where to start, to reach out to a community college, or even you could call me, you know, you can email me and I could find a student for you, or I could do it, you know. And so we're a very generous community. It's just we don't interact very much because we're just doing our nerdy data stuff. But we're very willing to help out with things like that. And that's what I loved about that case study too, is it took away that barrier and it just allowed you to focus on what you're best at.
We had some folks say, or Deborah, you mentioned, you know, I guess you took the time to reflect on how little we gather data from our elementary population about, like, you know, their preference in scheduling, you know, when they want to be pulled out, or, you know, when they would like certain things to occur. And so that just made me think about the way that in the case study things were like incentivized for students to be able to fully participate and give that viewpoint or perspective that would help faculty make better decisions, right? So they had like fellowships and students got stipends. We may not be in a position to be able to do that with our K through 12 students, but there might be other incentives that we can use to attract them to you know, conversations that we want, so we can gather some information about the things that they need or prefer in the classroom, STEM classroom setting. So I just thought that was a really great point that you noted that as well. We are actually going to have to keep moving on, but I really appreciate that you all engaged in this conversation with us. I hope you found this case study useful as you start thinking about some of the things that you can do. And actually, Danielle is going to lead us in a conversation and start thinking about how we can reflect on our own practices so that we can think more equitably about how we're collecting data, and then also use it in a way that's going to make make for more equitable environments for our students to be able to engage in STEM, and really thinking about students with disabilities and the barriers that currently exist and how we can reduce some of them.
So next slide, please. Next slide, please. Yeah, so think about the methods that you're using to attract perspectives from the target community. And I touched on this a little before about, web links. I feel like we've gotten, and this is, I'm not saying this about anyone in particular, I'm just saying we as a culture in data science have gotten lazy about expecting everyone to look at a link in their email. And thinking everyone's going to be accessible that way, and it's all going to make sense the way that you laid it out, and it's that's just simply not always the case. But it's more than just that. It's the qualitative work that we talked about. Another group I met with, we were talking about how as educators, and like the folks who work with my son Charlie, who he has many people in a very large team, they document a lot. They document many things, and they communicate with me all the time. They send me home little progress notes and they text with me. But we've always been taught that that's not data collection, right? Like that's not the big data stuff like a data scientist would need, but it is. It is, or it can be converted into that. And so I just encourage you to think about what methods you're using to get those perspectives. Could you do an advisory committee that's 4 or 5 people? A lot of times I do this in rare diseases. We have to rotate off of these groups because a lot of us have kids in the hospital, so it's unpredictable. But I'll have a group of maybe 10 parents that I can invite, and usually 5 or 6 are able to show up and give me advice that way. And so again, how are you engaging with the individuals? And I feel like you all have a better sense of what is going to work and what isn't. And you have great instincts about this. You all probably got into this work because of the narrative that you knew was true, and you wanted to make it better. And so all I'm suggesting is to learn how to use data to prove that, and to make the case for people who otherwise wouldn't be interested in helping you, or who are prioritizing other things. And how do you ensure that participants represent the diversity within that community? I thought this was such a good point when we were talking about this as we were planning this talk. I see this in the special ed world. The IEP, you all are familiar, I'm sure, of that big time, right? I just have the perspective, my lived experience, and some advising that I've done for other parents, but I'm a really good advocate because I have the time, money, resources. I've been able to hire professional advocates over time who could tell me all about the IDEA Act. I'm not intimidated to go into big buildings and talk to people who work for the government, right? And that is not everybody. And I'll see sometimes in the seizure community, I see sometimes in the seizure community parents who have no idea any of this exists, and oftentimes those parents represent underrepresented groups, whether because of race or maybe they're not from this country, maybe they don't have private insurance, for whatever reason. And so I think this intersectionality is really important, and I'm certainly not an expert, but I have observed that and I've also observed, just from knowing people who are advocates, that let's say people who are female with autism might be representing themselves differently than male with autism, or might have different challenges. And so thinking about all those little bits and pieces and making sure everyone is represented is hard, but that's where that qualitative work comes in. And somebody said, sidebar, there is software also for qualitative. Yes, there is. I use Invivo, but there's other software as well. And that's just to code the qualitative data. But I also hit it with artificial intelligence and Python. I do some really neat stuff where I pull everything out of the patient note and code it that way. But yeah, I like this. If you want to improve, you need to measure it. Yes, in addition to show them why it is important to take ownership so they will be the drivers of their destiny. My goodness, I want you to send me a text every morning, Ezekiel, because I love the way that you put things. Yeah, and so that's really important too. You know, we've empowered parents in the rare disease community and that, you know, educational community around special education. We've empowered parents to understand the value of their data collection. I advise patient advocacy groups on making a patient registry, which traditionally was something that a hospital or physician does. And here I have people who were a hairdresser yesterday, and now they have a child with rare disease and they're making a database because they want to drive their destiny. And how your data collection might be presented differently with individuals from the target community in mind. We see this in science. I always go back to my clinical research background, but we do the layperson summary, for example. I present things differently depending on who my audience is. An example of this, I'm very interested in kids with epilepsy not going to the hospital all the time if they don't have to. And a lot of the kids who wind up at the hospital are people who don't have good health insurance and they're using the emergency room, for example. And maybe they don't have a hospital that gives them access to a social worker. Maybe they don't have language interpreter. And so the emergency room is their only option. And so the other day I was talking about a study that I wanted to do. And I said, let's pick hospital utilization as the outcome measure to see if we're successful. And let's pick that because sometimes people don't care so much about the child's experience. Sadly, they're not connected to that. It's not something that makes them worried or up at night, but they worry about how much it costs. They know it costs a lot of money. And so when I'm talking to maybe more of a hospital leadership or an administrative group, I might talk about how much money we will save, right? If we do the right thing, you know? And that sounds jaded, but it's true. So understanding your audience is really important, and harnessing the data, secondary data sources. And I can put it in the chat later, but a lot of the work that I do around GIS and mapping, I map incidents of, you know, found cases of ALS over socioeconomic conditions of these different areas to show that we're not capturing people with ALS in places where there's a lot of people who are immigrants, or they don't speak English, or they don't have access to private health insurance and so on. So there's a lot that we can do for the different audiences. And I feel like it's very kind of activist and powerful to be able to do that. I love the quote we continue to use when trying to implement systemic change, especially when talking about challenges that occur in schools, whether it be with students with IEPs or Native American populations. Nothing about us without us. Yes, that's in disabilities. We use that too. Right. And I just gave a grand rounds talk at Hopkins, and that was a quote that I used. And it's simple, right? Don't talk about a population and what their problems are without asking them. And a surefire way to improve your data collection is to ask somebody from the affected population to sit on your committee and design the questions and the strategies with you. That's a surefire way to get a good response rate. Where, you know, how would we reach you, or your friends or the people you know, and start there. And, you know, how would this offend someone? Because I don't know, there might be something that I'm saying that's offensive, or a sensitive topic, or not something that they might use in their country, you know, that they would talk to a stranger about. I don't know. So that's all very important. I love that, Frank. Next slide, please. So, and then once you're collected your data, reflect on whether your data sample reflects the diversity of identities and attitudes of the target community. And this is what I was saying before. Does your data help you understand trends, differences between individual subgroups in the target community? I've learned a lot about autism over the years because, you know, I learned about it from my lived experience with my son, who has a very severe phenotype combined with intellectual disability, cannot advocate for himself, cannot speak for himself. I take care of him. And I speak openly about his, you know, about his condition. And then I started talking to people who have autism who are not like that and are, you know, working and able to live on their own and take care of themselves. And they're horrified that I would talk about my child and what life with him is like. And they hate the way I speak about autism, right? Wow, I needed to learn that. And so now that's something that I'm learning about and including them and trying to find that balance. And I'm not ashamed to say I didn't get that. And I feel bad that I said the wrong thing and didn't represent. So I can't talk about autism as one big monolithic thing. It's a lot of things, right? And so that's what I'm encouraging others to learn from my experience. And again, like girls with disabilities participating differently than boys, BIPOC students with disabilities participating differently than white students with disabilities. And all that intersectionality I just find so important. It's about the advocacy. It's about, you know, I have friends who don't have a job outside the home, who live out here in the main line. I live outside, I work at Hopkins, but I live near the main line in Philadelphia. And they can spend all day at, you know, and they have a lot of money and they can spend all day, the lawyers and the advocates, and they can go to the school and they can volunteer. And I can't do any of that because I have to work and take care of all of us, right? And so, but I can do a lot, right? And so I think to myself, like, how does their advocacy influence how their child is treated compared to, you know, somebody else who is just like, you know, working fast food or, you know, retail and just really struggling and unable to do that kind of advocacy. It's also, I'm reading the chat, it's also important to make sure that the data isn't misrepresented. A great example is the model minority myth. Yes, this is a great conversation to have. A lot of people think that Asians are one group with the same history, background, etc. However, different populations from Asia have different traumas, different stories, and different outcomes when they come to the US. And the model minority myth is very damaging to those who struggle that do not want to speak up. I see this a lot in the disability community too, as someone that is part of both of these subpopulations and identify with both groups. There is a lot of misappropriation of the data. I won't go on too much. I love this topic and what Dr. Boyce is saying. The thought came out of the idea of not weaponizing data that was mentioned in the article. This is incredible conversation that we're having. Absolutely. Absolutely. That's exactly right. And how somebody said earlier, people being afraid to speak up. Don't assume that people are, if you give them the opportunity, they're going to take it. That is such a hard thing to learn. This is really, I mean, this is why important. This is why it's important, the continuous cycle of improvement. You're not the only one. I'm going to pull this up. I'm going to look at this later, but yeah, I mean, you just have to be humble and willing to learn. That's the best we can do. And I also think a lot about teachers have to document, like my son's teachers, they already have to do so much. Documenting so much, like, you know, Charlie did 5 out of the 10 trials of the thing 6 times in a row, you know, that's what it says in his IEP. And I think to myself, if I'm a teacher, I'm not going to want to do one more thing that has to do with data collection, right? So this is what we're asking here has to be balanced with what is doable in your world. And that's something that I just wanted to acknowledge as well, because you're already probably being asked to do too much with very little. But I will say that making data collection just a habit and starting to think about how you can think of it as documentation and not data collection. Think about keeping a little log. I mean, sometimes that's a great way to start. Make a little Google spreadsheet of incidents and times and thoughts that you have around equity. And so later engage with somebody like me and say, how can we put this together? I do so much volunteering around this kind of thing. I'd be happy to help or connect you with someone who would help. I do too. I love all these comments and connections. I love this. This is great. Weaponizing data is a significant problem in education. I think people, teachers, parents, students, administrators, all the stakeholders react out of fear, emotion because of the weaponization of data. Google Forms to document for students has been a lifesaver for me. Yep. Yeah, I think so. I noticed that they document things around Charlie, and sometimes it doesn't even make total sense, but I feel like they're doing that almost defensively sometimes, like they are afraid if they don't, then they will be accused of like not doing their job or something, you know, like it's like they're very burdened with the amount of paperwork, frankly. And I feel for them, but I feel like a lot of times we all speak past each other because everybody's trying to do the documentation that they need to do, and it is weaponized sometimes. I've been very fortunate to I don't know, I'm a pretty easygoing, understanding mom on the team. So I've been very fortunate with the people who have really taken care of us, but I can see all of that to be true. And I really want to acknowledge the burden for you all in doing data capture. But I think if you do it on your terms, you can really make a big difference that in the long run will benefit you. Next slide. I don't know if I have any more slides. Yeah, and once you've collected the data, reflect on whether the methods you've chosen offer the greatest possible opportunities for you to make decisions. I wonder if you have any thoughts on that. You know, a lot of times we have to collect data, we don't have a choice. You know, I call that passive data collection. Like, call that state wants you to collect this, or you have a grant and you just have to click a grid, how many people you recruited for your study, things like that. But other times you say, listen, this is going on in my community and I want to change this and I want to get a grant for it. And I'm going to start collecting pilot data. And that's where you have an opportunity to use these skills and tools that we talked about today to really change your destiny and the destiny of these kids that you're in, these families, communities that you're working with.
All right. The next slide. This is Sherelle again. So we are running short on time. So I would love to give you an opportunity to just reflect on these different questions here, to start thinking about how you can apply what we've talked about in terms of data to your own team's needs. So first, what evidence do you have to support the problem you've identified? Thinking back to what's in your application and the challenges you've observed in your education system. Where's the evidence that supports that that's actually a problem of practice for you? Do you have quantitative data? And we've talked a lot about the value of qualitative data. Where does that exist? How can you capture some of that information? What other data can you use to tell that story, right? So maybe you are missing that context. How can you capture that information? Having a brief chat with Danielle, you have frequent interactions with family members, maybe on a day-to-day basis. Maybe there's some conversations and ways that you can document some of those conversations. Maybe it's emails, text messages. How are you getting this information, again, to support the problem you've identified? What additional data do you need to strengthen that story? Again, so maybe you have observed a challenge, but maybe the data that you've captured isn't really compelling enough at the point where you can truly say this is a challenge. Where else do you need to pull evidence so that again you can support this issue? And then finally, what barriers do you need to address to ensure that you are able to get the information you need to move forward with the idea you plan on working on and fleshing out during the summit? So again, we won't necessarily have the opportunity to talk in breakouts because we're just running short on time, but we will be sharing these slides with you. So if you want to dedicate some time in a future meeting with your team to review some of these things and maybe answer some of these questions as a team, I highly encourage you to do that. We're going to go to the next slide. And these are just some resources that Danielle has shared with us. Data.org is one that we've already dropped in the chat, and it's linked here as well. And then there's a video of weapons of math destruction. Danielle, I'm not sure if you wanted to share a quick little note about either one of these resources.
Sure. So Kathy O'Neill wrote this really great book, Weapons of Math Destruction, and this is just kind of a snippet of a lecture that she gave about it. She is a data scientist, mathematician, and she talks about how data can be weaponized in various settings, and kind of gives you the inside scoop of how that's done. And some of what she talks about is around education. And like kind of algorithms for determining performance and teacher performance and things. I just thought you would be interested in it. You hear this, you lie with statistics and think, well, statistics don't lie. You just don't do them right, or you don't interpret them right. Statistics are actually the most objective thing. But it's what goes into it. It's all this bias around the collection. So I thought you'd be interested in that, and maybe some of your students would be as well.
Thank you so much. So we are at the end of the discussion for data, but honestly, I could listen to you speak all day, Danielle. You are so amazing, so passionate, and it's just a beautiful thing to listen to you talk about the work that you do and the ways that we can connect to it, and really make a difference for the students that we support in education. So thank you again for being here and sharing.
Thanks for having me. And we went long, but it was only because we had such a lively discussion, which that is totally worth it. I mean, what a great crowd we had tonight, and great ideas. I'm just really heartened to see all of this. So thank you so much. And don't hesitate to put my email in the chat. Don't hesitate to reach out to me or on LinkedIn.
Of course. Yes, we'll make sure that all of her contact information is also available in the slides, so you can use that as a reference to connect with her. But yeah, Danielle, it's always a treat when you join us. So thank you again. All right, and so now we are transitioning for the last few minutes of tonight for final team prep. You will have the opportunity to just discuss any final things that you need to discuss with your team. We can go to the next slide, and I'm just going to do a quick overview of the summit objectives so we can refocus our energies on what's to come. Just a reminder that the objective for the summit is, one, to make sure that you have a logic model in place that you can implement at the end of the summit. So we'll be spending a good amount of time developing that plan at the summit, but we're also seeking to support you as teacher leaders to be agents of change in your schools or districts. And so we hope that by the time that you end the summit, you have the energy and enthusiasm to go out and get started working on the plan that you've created at the summit. And then we also want to continue to foster a community of professionals who are committed to improving education for all students. And so again, thinking about how we are leaning on one another, supporting one another, and just sharing in this community that really wants to make a difference for students with disabilities when it comes to providing them more access to STEM opportunities. That's what we're here for, right? So in the next slide, I just want to quickly go through the logic model template, just again to refocus our energy on what's to come and help you to think about the things that you might want to consider before we get down into working on a logic model. So a logic model it really is just an organizing tool that helps to develop a blueprint for your success. It's useful for communicating your plans to other potential stakeholders, so it can be a way for you to attract support, because it allows you to clarify your ideas in a way that allows other people to connect to what it is that you want to do. It holds everyone accountable to their assigned tasks. So it's, as I mentioned, an organizing tool that really lays out in detail all the different things that everyone on your team is expected to do. It helps thank you. It helps with identifying how you will measure success. So it's a reference tool that you can continue to go back to and track what you're doing and make sure that you're, on track to do the things that you set out to do to reach your goal. And then lastly, we consider it a living, breathing document. It is a way for you to continually adapt to the conditions that you are trying to implement your initiative or project in. And because of that, we encourage you to think about the logic model as a very flexible tool to accomplish whatever it is you've set out to accomplish. Next slide, and we can keep clicking. This is the template that we will support you in becoming more familiar with throughout the summit. On the second day of the summit, you'll have the opportunity to work through each element of the logic model template that we use, which is based on the Teach to Lead model. It consists of seven components. The problem statement and goal, which is, the key to a strong logic model, making sure you understand and can communicate clearly what your problem is and how you want to solve it and your vision for the future. So we will be supporting you in clarifying your problem and then writing a SMART goal that allows you to address that problem. And then the other pieces of the logic model consist of your inputs, your tasks, owners, outputs, and outcomes, as well as program evaluation. So with your inputs, tasks, and outputs, we're really focused on all the resources you have available to you, how you can use those things to start taking action and creating tasks or activities that you intend to complete that will lead to an immediate result after you've taken action. And then the outcomes are the impact of the work that you do. So who's benefiting and how? We want you to think about that as well, right? So you know what all of these activities are leading to. And then lastly, you have your program evaluation, which will allow you to measure your success and help you to determine whether or not you're on track to meet your goal. So on the next slide is just a list of different items that you might want to review with your team members. We had originally planned to give you some time to have that discussion tonight, but because again we are running short on time, we want to make sure that you have a chance to leave on time because we know this is your evening. I'm just going to go through this checklist, and I want to encourage you to take some time maybe next week, because we don't have any meetings next week. Take some time to maybe chat with your team and just review the items that are on this checklist. So number one, make sure everyone on the team is clear about your idea and the problem you want to focus on. I know some teams have had some team member changes, and so next week might be a good time to make sure everyone is on the same page. You also want to make sure that everyone is clear about the team member roles. So what are the expectations? What perspective are they bringing to this conversation? Make sure they know what their role will be during the summit. Also discuss any changes in your organization. Maybe there's an organizational culture that is shifting. Maybe there's some political considerations that need to be made. There could be other district-wide priorities that are underway, or some other DEAI initiatives that might want to be teased out, and you want to think about how the work that you plan to do after the summit maybe aligns with some of the work that's already underway. You also might want to share with your mentor, especially any updates about new support that you've gathered for the work that you want to do, and then any other things that just need to be addressed and fleshed out. And we can go to the next slide. Some of those things might consist of just communication plans, so being clear about how you're going to work together. Now, do keep in mind, we do have a Moodle platform. Inside of that is your team's general folder. So we've already set you up for success in that regard of having a place to share resources and collaborate together. But if there are other platforms, task tracking platforms or program management platforms that you like to use, just make sure everyone is aware. In terms of team norms and values, you'll want to make sure that everyone is clear about how you want to work together, what norms you want to set for the group, the things that you all value. Come to some consensus on that. And then lastly, working on a meeting schedule. I've heard from quite a few mentors that in order to set yourselves up for success, figuring out how you want to meet, how often, when, and where, really will make a big difference for, the success of the plan that you end up implementing after the summit. So having those discussions in advance will allow you to not have any time wasted after the summit is over. So those are some things you might want to discuss with your team members. Again, next week we don't have any planned meetings, so hopefully you can use that time that we have off to be able to go over some of these things. And then we can go, so these are the reminders for tonight. I just want to go over these really quickly, and then I will open up the conversation for any questions that you may have, because I'm sure you may have a few. Quick reminders: make sure to submit team slides to Akima. She sent out an email earlier this week, so please reply to that with an updated version of your team slides. If you have not already done so, please enroll in Moodle. And we're offering the opportunity for folks who are interested in participating in our first stakeholder engagement program, the opportunity to fill out an interest form. We'll have 2 sessions, one that's going to be a student panel discussion, and then another session that's focused on receiving student feedback for the logic model plans that you've put together. So if you're interested in participating in either of those experiences, we're asking you to just go ahead and complete an interest form so we can get a better sense of who all wants to attend, and we can kind of start getting ourselves prepared to organize those events in the fall. And we'll add you to our communication list so that you remain updated on any updates regarding that program when it kicks off. Lastly, just want to remind you that if you have not received your itinerary yet, it's coming. You'll get one final email in advance of the summit to kind of prepare you for what's to come, and in around that same time you'll also receive your itinerary, if you have not already, within the next few days or next week. So, well, today's Thursday, so either by tomorrow or next week. So if you haven't gotten it yet, please hold off on sending an email out to Alex. She will make sure to get it out to you. Some folks have had special requests, and she's working to make sure that those things are taken care of as well. So do know it's coming. We haven't forgot about you, but just be patient with us, because there's quite a few itineraries that she has to get out. So we have 2 minutes left before we wrap up for tonight. I do want to open up the conversation for questions if anyone has them. We can take down the slides, and like I said, we'll just open up this session for questions. Can we anticipate? Give me some. Okay, yes. So in that email that I referenced earlier, the question was, when can we anticipate receiving an agenda outlining the day-to-day timelines for the summit? So there actually is a agenda in the Moodle forum, right, or the Moodle course right now. It You can reference that. It has all the times for all the different activities for the summit. I'm just updating the agenda that I'll be sending out to you next week with like presenter information. But if you're just looking for activities and times, all of that is already in Moodle. So you can reference that. But if you'd like me to forward the email to you with the agenda, I can do that as well. Is there a specific address of the summit? We're trying to plan transportation to and from the hotel. Yes. So we'll be at Gallaudet University. That final email that I told you I was going to send out, I'll make sure that the details for where to go, what building you need to enter, all of that information will be in that final email that you'll receive next week. If you can hold out that long. If not, I'll make sure to get it to you sooner. But if next week's okay, I'll make sure you have it. Okay, for team slides, please have a team member submit slides for the team. I want to make sure like a team lead essentially could do it, but as long as one member of the team is submitting slides, that's ideal. We're not asking mentors to submit slides. So again, the team slide assignment is for one of the team members to complete and submit to Akima. Just so I'm clear about that. Is transportation to Gallaudet covered from the hotel? I know transportation from the airport to the hotel is not. Right, so you will, on day one, which is July 25th, you'll be responsible for getting yourself from the airport to the hotel and from the hotel to Gallaudet. We'll take care of all transportation after that. So transportation from Gallaudet on the first day back to the hotel, we'll cover that. All the transportation from the hotel to Gallaudet on the second day and the morning of the third, we'll cover that as well. The only thing you're responsible for is making sure that you get yourself to your hotel in Gallaudet on the first day, and then of course on your return home from either Gallaudet or the hotel, you'll be responsible for that as well. And I think Alex also answered that in the chat. Okay. So the time is now 7:02. I just want to again say thank you to all of you for joining us for our final session. Thank Danielle, of course, for all of the fantastic information that she imparted on us tonight. As I said, it's always a pleasure to have her come and share her knowledge with us. I always feel like I've learned so much every single time she joins us. So I hope that you enjoyed this conversation, and I hope that you find use for what we discussed tonight as you continue to think about the work that you'll be doing in the next few weeks. And with that, good night. Have a wonderful night. Take care.